You're watching the Wellness Hour, news that makes you healthier. I'm Randy Iris. Today's topic, replacing missing teeth with dental implants. We've had him on the program before. He is New Jersey's go-to implant dentist. We have Dr. Jonathan Abenaim. Dr. Abenaim, welcome to the program.
Thank you so much for having me today.
We've had you on the program before, and amazing photos. You brought even more photos today.
Yeah.
So now for people that don't know your practice, who's your typical patient?
So the typical implant patient is that we divide it into two different categories. Number one, the patient that's been wearing dentures for 6 months, a year, maybe 10, even 20 years.
Okay.
So we look at those patients. And then the other patient is they're on their way to dentures. Maybe their dentist told them they need dentures. Maybe their friends told them they need dentures. They know that their teeth are not doing that great. And it's time to do something.
Now, we've had you on the program before. A lot of people watch the program, you say several times, and they come. So you see patients almost every day from the interview.
Yeah, I mean, almost every single day we get a patient that comes in, maybe multiple patients, and they say, Jonathan, I've been watching you for months, and I had the courage to finally call you. I'm so happy that I'm here because you're giving me the solution nobody was able to.
Okay, good. Now you have this program where it's a fast way to get dental implants, a new set of teeth. You call it the Excel. You're the inventor of this Excel. You teach dentists across the country this protocol. Tell me about that.
Yeah, so, we know that dentistry is not the funnest thing in the world to get to. So I wanted to invent something to be able to make our patients get to where they need to be with their smile, with their chewing, with the way they feel about themselves as quickly as possible, as minimally what we call disruptive as possible.
Okay.
To really help them get there. And I created this process, me and my team, and we're able to get them to where they need to be as fast as 3 visits, sometimes as fast as 3 weeks.
Okay, interesting. Now, you brought us a stack of photos, so we're going to try to get to as many of those as possible. But, we're in the green room and you're saying this really, and I'm paraphrasing slightly, but this really changes people's lives.
Yeah,
really?
It's, well, listen, we help them change their life. There is something about them that's holding them back. Sometimes we think it's maybe their weight, maybe the way they look, but really sometimes just their teeth. They don't get to eat the way they want to eat. They don't get to smile the way they want. They don't get to chew the way they want. They don't get to go out places where they want to go. And this really allows them to be their best self. And I'm just so excited to be able to give this to them.
Now, are there that many denture wearers or people that are headed for dentures in New Jersey?
Listen, in New Jersey we have MetLife Stadium.
Okay.
If I had to fill MetLife stadiums with the amount of patients that need it, I could fill it 3 to 4 times over. People need it because the dentistry that they've had or the dentistry that they thought they needed is just not working out for them. They don't feel the way they're supposed to feel, and that's what we help them do.
Okay, now this whole thing, because you mentioned earlier, or at the top of the show, that some people wearing dentures 20 years come to you. Now, but isn't it true if you've been wearing a denture that long, you can't do this because you don't have enough bone?
It's interesting that you actually say that. A lot of dentists believe that. They told their patients come in, they say, doctor, I can't wear this plate anymore. I need a better option. And the dentist says, listen, you got no bone. It's been 20 years. We can't help you. Well, we've developed something for them. Everybody's a candidate. If you're able to get in the car and drive to my office, you're a candidate. I can help you. And not just with snap in, snap out. I can give you permanent teeth that day that you walk out with.
Now, is this true too? I'm going to put you on the spot. That people could have literally on the day of the procedure, they could walk in with no teeth and walk out with teeth upper and lower that don't come in and out. Brand new set.
Brand new set. That's my digital process.
Is that rare?
This is our process. This is our commitment to our patients. You come in with a denture, or you come in with broken teeth, or you come in with unhealthy teeth, you walk out healthy. We do this for you. People walk out with permanent teeth the same day.
Okay, good. And people are finding it, because look, Medicaid, Medicare, it really doesn't cover this procedure, but you say people are financing this every single day.
Yeah, 90% of our patients finance it. We help you through the process. My team will sit down with you, they'll discuss everything with you, and we'll find a budget that actually makes you able to get this treatment for you.
So it's not like you're carrying the loan yourself. These are, you have to have decent credit to get this done.
Yeah, we have third parties that allows you to get this done, and even if you don't have decent credit, you have a co-signer to help you get this done. It's all there. You just have a will. If there's a will, there's a way. So listen, Randy, you asked me a question before, and I told you that I change people's lives with their help. And you were skeptical. You said, Jonathan, you can't really do it. It's just teeth.
I said that in the green room.
Yeah, so I'm going to show you cases. I'm going to show you patients that, according to them, we've changed their lives. That they feel better about themselves.
Okay.
They look better. And let the pictures do all the talking. How's that?
Okay.
Here we go.
Let's take a look. What are we looking at?
Okay, so here's my first patient. She came in. You can see she's a beautiful lady, and she's young. And she went to her dentist, and her dentist told her, "You have gum disease. You're going to be wearing a denture." She was smart enough to.
She seems very young to be.
She's young. Yeah, she's young, and unfortunately, she had gum disease, and she couldn't get away from it. But her dentist told her, "You're going to wear a denture." And she said to herself, "There's no way I'm going to wear a denture." She did some research. She found us, and look at what she looks like now.
Wow, so she would have been wearing a denture.
She's never worn a denture. She never walked out of my office with a denture. She always had permanent, beautiful teeth.
Looks very nice.
Yeah, I'm blessed to be able to do that. Listen, when we give them their teeth, that first day, it's so much emotion because people have been thinking about this forever. They've been saying to themselves, "Nah, I don't deserve this. No, I'm okay with this." When we give them the mirror and they see their smile, it changes them.
Do they get choked up?
They get choked up, but it's like a click. Something happens inside of them.
Really?
We see them in 2 weeks to take a look at them. Their hair looks better. Their makeup looks better. Their swagger looks better. Everything about them changes. Their health gets better. They just feel great.
How old can you be to do this? Like, what are some of the older patients?
I have the perfect case for you that comes to mind.
Okay.
So, patients say to me, I'm a little bit too old. I don't need to do this. I'm going to die. Or I'm 60, I'm 50, I don't really need to do this. Let me show you this patient. This patient is 90 years old.
Wow.
This patient came in to see me and she said, "I'm tired of living the way that I'm living." And I said to her, "Why do you want to do this?" She said, "Jonathan, even if I live for 2 more years, I want it to be the best 2 years of my life."
Okay. Does she want to eat? Like, what's her biggest complaint?
She was sub 100 pounds. She wasn't healthy. She wasn't able to consume the foods that kept her alive. That made her feel good. She came in with her daughter, and her daughter said, "My mom needs to eat. She can't eat." Obviously, to look good is also great.
Yeah.
In one afternoon, Randy, I took out her broken teeth, I placed the implants, and she walked out with a brand new set of teeth.
Looking like
brand
this.
New, looking unbelievable.
So a 90-year-old, they're not, statistically, they're not more likely to fall out at 90?
No, they're actually very healthy.
Okay.
These patients are healthy. Like I said, you get in the car, you come in, you're healthy. I can help you.
How soon could she eat? Like, if everything works out right, how soon could a person like this eat?
Time she gets home, she feels great. She's ready to eat. As the implants get stronger and stronger, she eats more and more food and stronger foods, and she feels great. But let me tell you something. People say to me, I'm too old. I can't get this done. I show them Joan.
Like 70, 80 is not old at all anymore.
It's perfect time. It's time for you to take over, to be able to say, I'm tired of this. I'm tired of my status quo. I'm tired of being the way that I'm tired of taking my denture out at night. I want to feel great. I want to be able to just go to the restaurant, pick whatever I want to eat, go out with my friends, and not think about, I got to bring my glue to cement my teeth in. But let me show you this next patient.
All
this
right.
one is another great one. So this is a patient. His name is Richard.
Okay.
He's a professional football player, and he had everything accessible to him. He came in, he's big, he's tall, he has a big presence, but he had something that was holding him back. You can say, well, maybe, he's getting a little older, a little bit smaller, but I knew deep down this person was a beautiful person. Look at what he did. He waited till he was in his 70s.
Okay.
He came in one afternoon. We put in his implants. He walked out with a beautiful smile. Now look at it. Look at how amazing he looks. And let me tell you something. When he comes in every 3 to 4 months to maintain his teeth, I hear him from the other side of the office laughing. He always has a big, bright smile on his face. It's amazing. It's rewarding that I could do this for these patients.
So what do they like more? Do they like the fact that they can eat, or do they like the way it looks?
It's funny. There's 2 types of people that come in, and they say to me, Jonathan, I don't care what my teeth look like. I just want to be able to chew. But I say to them, as an extra bonus, I'll make your teeth look great.
Okay.
Because everything comes together. If your teeth can't come together correctly, they probably won't look good. And if they look good, they may not come together correctly. So we make both of those things happen for you. Chew well, feel great, and smile. Because let me tell you something. You know what happens? The people that say, well, I just want to chew. Someone gives them a compliment and say, hey, you look great. What'd you do? They don't always say they had dental implants. They said, I got a haircut. But they know deep down it was worth it. Now
so
they got
start
that validation.
Smiling more and more compliments.
They just feel great. They buy new clothes. Their swagger changes. I'm telling you, these people are like new people. They're reborn. They're rejuvenated. It's unbelievable how something like this can do for them.
Now, your center in New Jersey. So I guess how implants are typically done, you go to one place that does like the imaging, another place where the surgeon does the implants, and then another doctor that puts the teeth on top. You do it all right there. That's what this Excel program is.
So this Excel process.
But aside from convenience, what's the big deal about it?
Convenience is a big deal. We allow our patients to not have to go meet multiple staff, multiple doctors, and be given the runaround. They come in, they meet me, Jonathan Abenaim.
Is that right? So you still aren't too busy, you do the consults?
No, I do the consults. I not only do the surgery, I make your teeth, I fabricate your teeth in my center.
So you have like a what do they call them? Labs right there in your office.
Yes,
that makes the teeth.
Yeah, but there's no like lab. I'm the person that sits and I hand paint every single one of these teeth that you're seeing on TV. I hand painted them.
Really?
I created them.
I didn't know that.
Yeah.
Were you doing that the last time you were on the program?
No, this is something that we've been doing for our patients because we're not connected to the teeth. When I meet the patient the first time, I get to know exactly what they want. What is their goals? I'm able to take a paintbrush and show what they wanted, what they said to me on the day of the consult. This is what I want in my mouth. And able to create that specifically for them. It's dental art. We're able to put this for them so that they can chew and smile great.
You love this.
It's my passion. It's my life's work. I've spent my whole life to be able to create this for my patients. Because dentistry is not fun, but this is so easy for them. They just come in, they sit down, we take a digital camera, we do our surgery very well, we make our surgery just so precise that there's no questions. There's no more, didn't work out the way I wanted it to.
So it's kind of like one doctor, one price, all done right there.
All done right there. And it's predictable for our patients. Okay, let me just show you one other patient. This is just so unbelievable. So here's this one patient. This is Vicky. Vicky, I'll never forget. Vicky came in, we said to her, can you smile? She didn't know how to smile. As we started talking to her, she said, I've been to a neurologist because I think that something's wrong with me. And I said, what do you mean? She's like, I can't smile. Her brain has now conditioned her to say, you can't smile. The muscles of her face don't work. She can't smile correctly.
Or she feels very uncomfortable if she does smile.
Correct.
Okay.
We went ahead, we took out her infected teeth, we took out all the disease that she had, and then we went ahead, we rejuvenated her smile with dental implants. And look at her now.
Very nice.
She can't stop smiling. All she does is say, thank you, Dr. Jonathan. But I really want to say to her, thank you. Thank you for letting me do this for you, because this is just, it's amazing. It's why I got into this.
Do you get recognized on the street now? Because I mean, you're busy in New Jersey. Do people ever say, I've seen you? How do I know you? Because you're a lot on television.
Yeah, I mean, I'm a pretty shy person as it is. So when people stop me, I sort of blush. But yeah, they say, oh, you're Dr. Jonathan. I saw you on TV. And I said,
Did they ever ask about me when they see you?
Randy, you? Come on. No.
Okay, good. They don't ask. Well, if they do, you could say something nice about it.
Absolutely.
Time for a few more. What else are we looking at?
All right, let's do this
Very
one.
nice.
Let's do this one. This is Maria. Maria came in. She was told also she's going to be wearing dentures for the rest of her life. She had gum disease. You can see that there's something about her that she's dying to smile. She's dying to feel a specific way. But look at the difference. Look of where she's at. It just brightens everything up.
I think anybody looking at this would agree. I mean, she becomes more attractive. It doesn't look like the same person. She even looks more sophisticated, like more refined and educated.
But to me, her after is who she really is. It's not like I created a new person. The before is the person that she had become. But the person she really was is on the left. But let me tell you something that was interesting. She went home and her husband said, hey, that's not fair. I also want to get the same thing. Let me show you her husband.
Okay. So husbands and wives it's very common that they're coming in together?
What happens is that actually the husband or the wife come in first. They sort of, whoever's the more bravest, they want to see, is this for real? I saw this on TV. I've heard about this. It can't be real. So she gets this done. She feels great. She's dancing around the house. She feels unbelievable. And the husband says, hey, what's going on? I haven't seen my wife like this in so many years. Maybe I should have the same thing done.
Okay.
Well, here you go. This is her husband.
Oh my God.
He had this done.
The before is terrible. I mean, is that really common to see something this dramatic?
It's, what happens is people sort of get used to where they're at and they don't know anymore because they don't go to the dentist because of fear, because of time, because of money. And they say, I can't get this done. The spouse goes in, they see what's possible, and they know it's finally real, and then they get it done.
So on the consult, do they ever come in, let's say they've seen a lecture, or they've seen your YouTube, or seen you on TV, are they still skeptical sometimes? Like, that it can happen for them is, I guess, what I'm asking.
Yeah, especially the patients that have seen it 3-4 times. They've seen the program so many times, and they said, this just can't be real. But you know what? Let me come in, consult's free. Let me see what he has to say. I had a patient the other day. He said to me, I'm skeptical. I'm Mr. Skeptical. And I said, that's okay. I guarantee you're not going to be skeptical when I'm done with you. We did his surgery, and we gave him a brand new set of teeth in one day. 24 hours later, he called back and goes, I'm not skeptical. Thank you for changing my life.
Well, that's nice.
Yes. And I just want to get into it. Here, another one. I want to show you another husband and wife.
All right.
The husband went first in this case, and then the wife went right after. And his wife came in and said, I just want you to do what you did for my husband. And, it rejuvenates relationships.
So these are both people that would have been wearing dentures.
100%. Some of them are wearing dentures, and they said this is enough.
And these aren't the snap in, snap out kind of teeth. These are teeth.
These are permanent teeth.
Okay.
They're not just screwed in dentures. These are permanent teeth. They're zirconia. They're beautiful. They're translucent. They look like natural teeth. So nobody will ever say to you, hey, look at those implants. They look great. They'll say, what'd you do? You look so good. Did you go on vacation? Did you have a haircut? They'll never know, because what we believe in, our patients are beautiful frames. They're just beautiful frames. We have to go ahead and put their picture in. And the picture is the teeth. We make them straight. We make them in harmony with your eyes, in harmony with your lips. We don't give you, people say, don't give me horse teeth. I want beautiful teeth.
Okay.
So with my digital process, everything is based off of your smile, off of the proportions of your face. And because it's so digital, because it's so high tech, it's done so quickly. It's done so quickly and so.
Is that right? You actually kind of pre-plan the surgery on a computer?
Everything is pre-planned digitally. Everything is done on a computer. We take a picture of your face. We take a picture of your teeth. And no more molds. None of that stuff that people are like, I can't deal with that. Everything is digital. This is part of my invention. This is how we allow our patients to get what they've always wanted. Just think it's not acceptable. It didn't exist.
So people need to know, look, this is a real interview. I'm not trying to endorse you on this program, okay? But in the green room, it's hard to say, I think we're doing it better than anybody else, but you actually are one of the guys that actually thinks what you're doing is so unique. You're doing it better, faster than just about anybody else. Is that fair to say? You believe that?
I truly believe that, because our concept is really to recreate and enhance nature.
And you like more implants, by the way. I'm sorry to interrupt you, but you like a little bit more implants than typically done.
So I know a lot of centers, they come in, they may not tell their patient, they cut a lot of bone, and then they give them bolt-in dentures. We don't want to do that. We really want to recreate your smile the way that it was, or make it a little bit better. We really save as much tissue, as much bone as we can. We place as many implants as possible, and we don't charge more for it.
But you're only talking about 6 implants, right? To give them a full arch of teeth, usually.
6 implants, 8 implants, whatever the size. A 6'5" guy is not going to get what a 5'2" woman is going to get. Everything is customized exactly for you, so that you have your teeth. So here's the thing: we want these to last you for as long as you live. So we over-engineer every single case we do, so that you never have to worry about it. And when you're all done, you're into our system, you're into our maintenance program. We see you routinely, have your teeth cleaned.
So just like your own teeth, you just go to the dentist a couple times a year?
Even better.
Better, because there's no cavities, I guess.
And it doesn't hurt. It just looks great all the time.
Now we're short on time, and so I don't mean to rush you, but we'll try to get as many of the photos in as possible.
I really want to show you this one.
All right.
This one is a big deal. This patient comes in, I want you to take a look at her. She's unbelievable. You look at her, she's happy, she smiles. But she said to me, Jonathan, I travel all over the world. I want to feel great. I meet people all the time. There's something that's missing, and it's my smile. What can you do for me? Because everybody told me they can't help me.
What do you mean they can't help her?
They gotta wear braces, I gotta get some fillings. Old school dentistry, I just don't want. I wanna look rejuvenated. I wanna look great. Take a look at this.
It's very nice.
It's just.
Are these like porcelain veneers?
She has a combination of veneers, implants, all of that stuff, the whole gamut, everything with my process, so that it was easy for her. She was done in 3 weeks.
Very nice.
Unbelievable.
So somebody watching this right now, 3 weeks from now, you get a brand new set of teeth.
Done.
If it all works out properly.
Absolutely.
Good.
So now I want to show you, the next set of people I want to show you is just people that have had dentures. Unfortunately, they didn't find me in time. Their dentist pulled their teeth, they got dentures. You know what happens when they got their dentures?
What?
They don't wear them. They come to my practice and they say to me, I'm a denture wearer, but I don't have a denture. Please help me.
Really? So they have dentures, they just don't wear them?
They just don't wear them. And it's so common. They say they don't fit right. They move all over the place. It's just not what I want. I can't deal with it. I'd rather just gum my food.
Okay.
This, we have the ability to change them. So
Wow.
so this guy can go from not having any teeth to having this beautiful smile and being able to chew, being able to eat, being able to talk, being able to say the way he feels because his newfound confidence. It just looks unbelievable.
Okay.
Here's another patient, and she walks in, she's like this. Her hair is not the way she wants it to be. She's trying to just camouflage. She doesn't wear her denture, and she talks to people every single day.
With no teeth in her
No
mouth.
teeth, but she talks with her mouth over her hand over her mouth.
Okay.
And she really wants to feel great. She said, just help me, Jonathan. Just help me get to where I need to be. And this is what my process can do for them. What I really want you to look at is look at the before and after.
Okay.
You will never even know it's the same person. Maybe that's even her
true.
daughter now.
Yeah, yeah.
And it's the way she feels. She comes in, she has makeup, she's on time for her appointments, she's excited to finally come to the dentist. Can you imagine that? To be able to say, I can't wait to see my dentist to make sure my teeth look great. And they just want to maintain it.
Now, on the consult, when they're telling you their hard luck story, do you ever kind of look at them and go, like, get kind of excited where you're thinking they have no idea how good this could be? Does that happen? Like in your mind?
You know, what I have the ability to do with me and my team is that we can see something, we can see a patient, and we know exactly what they're going to look like after. So sort of like the decibels in our voice goes up because we're just so excited. I have when my treatment coordinator calls me in, she's like all giddy and excited, and the patient
Really?
doesn't understand. Say, what's going on here? I'm like, do you see how excited she is for you? Because she knows we've done so many cases just like yours that we'll go ahead and we know what you're going to look like. Let me show you some cases that we've done. I want to show you just this patient.
All right.
This patient comes in, okay? Look at his before.
Okay. Doesn't look like a happy guy.
It doesn't look like he's happy. And you may say, well, he's grumpy. He said to me, Jonathan, help me. And I never thought that he would actually transform. I knew I would change him. But this guy's a new man. He's glowing
Look at that.
almost.
Looks good, yeah.
He's glowing almost. It's just truly unbelievable. And this last patient, this is unbelievable. This is just great.
Okay, okay.
Because I want you to take a look at him. This is Will. If you look at his before, he's pretty happy. He's smiling. He's just a happy-go-lucky guy. But his wife brought him in. She said to him, I want something for my husband. He's happy, he's good, but I know he can do. He's tall, he's strong, he's a very good-looking guy. But you can see what we can do to these patients. We can change. All of a sudden,
That looks good. He does look good.
he's got a twinkle in his eye, and this is what I want to do for patients because they deserve this.
Do they ever tell you what they want to eat? Like, do they ever say, I just want to eat this again?
Yes, at the end of when we give them their teeth, we ask them, what's the first thing you're going to eat? Steak, hamburger, pizza. Just these are things they couldn't have before. And it just really transforms them. And I'm really blessed that these patients allow me to do this for them.
All right, so no more dentures. So we have to mention again, because we get emails about this too, that even the best dental insurance only covers a very small part. Medicare, Medicaid for sure, doesn't really cover this at all. And people are financing this. So you do it right there? Can you even do it over the phone, like a pre-qualification?
Yeah, well, patients come in. If they want to get pre-qualified, we can do it over the phone. It takes less than 5 minutes for us to know if you're actually qualified. And we have a lot of different payment plans based on your budget.
If you're in your 80s, most of these 80-year-olds have a little bit of osteoporosis or they're on a few medications, they could still do it.
Yeah, so what we do is we are doctors. We have to make sure that you're healthy. So we work with your medical doctor. We have conversations to see how we can get you healthier and how we can get you clear to be able to get this done.
So what if your gums are bad, like bad gums? Are your gums too bad to hold these implants?
Yeah,
that's my question.
So I want to show you a case. I'm so happy that you brought this in. So here's a patient that came in. His gums were bad, his teeth were bad, and then we were able to actually transform him. This patient, unbelievable person. He's happy, he's smiling, but he didn't know how to smile before. But he was told he's not a candidate. He said, you have gum disease, you got broken teeth, you don't have enough bone, we can't do it. Full set of teeth, upper and lower, implants, my process, not dentures. Pure, permanent, gorgeous looking teeth that are natural.
Looks good.
It's just unbelievable. And
so this is that common where people all the time are saying, I was told I couldn't do it.
It's very common. Not only were they told they couldn't do it, they were told that it was too expensive and it was out of their price range. They weren't given options to be able to get to where they need to be. Because of my process, I knew that not everybody can get the top.
There's only like a handful of guys or companies that could even do it this quickly. Is that fair to say?
That's correct.
Okay.
I'm teaching it around the world, so they're starting to catch up. But I can tell you that we have so many options for patients, even within the permanent teeth spectrum. They don't have to jump to the lower denture snap in, snap out. Even within the permanent option, we have options for patients that are affordable, that be able to get them to where they need to be. Because everybody deserves that, to be able to choose. So Randy, do I have time for one more?
One more.
All right, let me give you this one. So here's an unbelievable patient. She came in, she's smiling, and something's going on. She's missing a front tooth. She's a young lady. She feels great, but something's holding her back. And she said to me, Jonathan, can you help me? Because I've been told that I'm not a candidate. I've been told that it's too expensive. I've been told that it's going to take 2 years. I have to go to 3 different doctors. I have to worry about all these variables that come in. Can you help me? I said, absolutely. You're my patient. I'm going to help you and I'm going to change your life. Look at what we were able to do for her after.
Pretty smiles, very nice.
Unbelievable. She's a gorgeous lady. She comes in, we see her. She was very reserved before, but now she's open, she's smiling, she looks great. Again, I'm so blessed to be able to do this. I love it.
Now, do they get, so, I mean, you have more photos than just about anybody that I've interviewed, okay? And I told you in the green room that this says a lot about you. I mean, people must like you, obviously, if they're saying, hey, you could show my photo, an embarrassing photo in certain cases, on television.
Yeah, they're excited.
So these people have all approved that you could use them on TV.
Yeah, they're excited to show their transformation because people are proud of it. They said, look at where I was, and look, I was brave, I got it done, and now I'm not looking backwards because now the future is for me, and I'm going to live my best life possible.
Okay, good. Well, look, I'm inspired by this. I think everybody watching it, so good for you, and I'm not trying to side with you. It was a great information. They could go to your website. Can they make an appointment online?
Yeah, they can make an appointment online. They look at our website, look at our Instagram, our Facebook page, and they could see every single day we post these stories of these patients being transformed.
I follow you on Instagram. It's like every day is another patient, another,
Yeah, it's really important if you're going to pick.
How do you have time to do all this if you're doing it on your own? Just the team?
When you love what you do, it's easy. And I can tell you, when you pick your implant doctor, don't pick someone that does maybe 1 a month or 1 a year. Pick somebody that does it every single day, like it's routine, a habit.
Because you're obviously, are you that much better than when I interviewed a couple years ago, or whatever that was?
Every day is a learning curve. I always learn that every single day we're going to get better and better. Stagnation is not good for us. We want to get better every day, provide better service to our patients, better solutions. Just get there.
Final message, somebody watching this, they're either headed for dentures with bleeding gums, bad breath, loose teeth, their teeth are failing, or the denture wears. Let's say they've heard this and they're still going, I don't know, I'm too old, or it seems like a lot of pain, or what. What do you say?
Just come in for a consult. Let me show you what we could do for you. Let my team sit down with you. We're going to educate you just to show you what is possible. Then if it doesn't work out, that's okay, but it will, because I will do this for you.
All right, Doctor.
Thank you so much.
Abenaim, thank you so much for coming on the program. Great stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
You should have the XL implant process because it's what you believe in. It's what you think you deserve. But you're too afraid to get it. Whether it's because you're afraid to go to the dentist, whether it's you're afraid of the cost, whether it's the pain, whether it's the time. This was designed for you. It was designed to make the experience as easy, as joyful, and at the end of the day, to have the smile, the teeth, the life you've always dreamed of. That's why you need this process. So us as dentists, we're creatures of habits. We like to do the exact same thing over and over and over. And sometimes we forget you. We forget you, what it means to be a patient in the chair, what your time means, what your experience means. So what we did 10 years ago, 20 years ago, we don't want to change. But for me, when I actually saw what I was doing to my patients, how the process that we were taught kept going on, I said, this is insane. How can a patient want to sit through this? So I created this process to make it as easy as possible. And what we promise you to happen, we can deliver every single time. There's no questions. There's no, oh, I'm sorry, we can't do it. Oh, I thought it would be that great. We know what it's going to be before we even start. We begin with the end in mind. With traditional implant treatment, the doctor will remove a large portion of your jaw to be able to make their teeth fit your mouth. With my Excel implant process, we make the teeth fit your mouth. What does that allow us to do? Save time, save money, less pain, and more enjoyable. And guess what? You get the smile you've always wanted much quicker. So when you choose the Excel implant process, our commitment to you is the day of your surgery, you walk out with the teeth you've always dreamed of. Usually you'll be happy by then, but we take it a step further. Once you heal and you have the gorgeous teeth that you're used to wearing, we will make it a step better. Once you've had your Excel implant process complete, you are now part of our family. You are our responsibility and you are responsible to us. So we will see you, you'll come visit us once every 3 months to make sure that everything's okay, everything is tight, everything fits perfectly, everything still looks good. You see our beautiful hygienist, she'll go ahead, clean your teeth for about 45 minutes, and then you're on your way. The maintenance is really almost nothing. It's built bulletproof, but we want to see you to make sure that if anything needs to be tweaked, we catch it before it goes wrong. They maintain better than natural teeth, and they last longer than natural teeth, and they feel better than natural teeth. So 3 months, no problems. Dentistry can be very mundane. It could be very uncomfortable. It could be something that you really don't want to spend your time doing. But I understand that as a dentist, I've been given the ability to change people's life. I've made dentistry my passion. This is why I invented this process. This process was invented for you, the patient. This was invented for you to be able to have what you want to feel, to be able to afford it, to be able to not be afraid to have it done. I'm telling you, I've spent my life creating this. I've spent every waking hour that I've had to be able to give this for you. It is my passion and my promise to you that give me a few minutes, meet me, and I will change your life. We utilize technology to take everything that people hate about the dentist and we get rid of it. And we allow technology to step in and say, wow, this is the way dentistry should actually be. This is the way I should take a mold of my teeth. This is how long it should really take. This is how well it should actually come out. That is the Excel implant process. We created something for you to get what you've always dreamed of, and utilizing technology to give us the best result possible. If you are able to get into a car, drive to the grocery store, buy a carton of milk, that's your first step to being a candidate. But if you're a person that says, I'd like to reverse the hands of time, I want to be able to get the way and feel the way that I felt when I was young, when I had all my healthy teeth, well, this is for you. It's very simple. Pick up the phone, call my team, we'll schedule you in for a consultation. We'll sit down one-on-one, we'll go over your goals, we'll take some digital records. It'll be very, very painless, and we'll talk. We'll talk about your goals, we'll talk about to see if you fit into the Excel implant process mold, and we'll change your life.
Hey everybody, I'm Dr. Jonathan Abenaim. I'm the founder of Smiles by Jonathan in Hawthorne, New Jersey. We are a full scope dental office. where we focus mostly on implant dentistry and life-changing dentistry. We've created the Excel dental implant process that gives you the smile that you've always wanted. We're a fully digital office where we have the ability to make your teeth in-house, customized specifically for you the way that you've always dreamed about it. I have the best team in the world. They're passionate about what they do, they care about my patients, and they love coming to work every single day. When a patient comes to see me and they're looking for somebody to really look out to help them, I'm blessed to be able to be that person that they choose. When I finish with the work that they need, it really impacts them in the fact that they now have the confidence that they've always wanted, they now have the smile that they've always wanted, and they feel the way that they look, which is amazing. Hey everybody, I'm Dr. Jonathan Abenaim. I'm the founder of Smiles by Jonathan in Hawthorne, New Jersey. My practice is a full-scope dental office where we focus mostly on implant dentistry and life-changing dentistry. I have the best dental team in the world. The care that they have, the passion that they have for what they do is unrivaled in the whole world.
I recommend everybody I know to come to see Dr. Jonathan. He changed my life for me and can change the life of you.
After seeing a few dentists and it wasn't very possible with them, I saw Dr. John and he told me that he'd like to work with me and try. He was always really enthusiastic to help me. I really wasn't very hesitant at all. I was very happy to come here because he was really positive about working with me.
I came to Dr. John because of many years of neglect. I had a lot of missing teeth in the back, so I wanted to fix my smile. So before I got the teeth, I was ashamed of my smile. Now, my smile is perfect now. I could, you know what I mean? I laugh all the time, I smile all the time. You know what I mean? I laugh when I don't even have to.
My favorite thing about working at Jonathan Dental Spa is being able to see the reaction at the end of the day when the patient sees their brand new smile.
Come to our office, meet my team, meet me. Let's see if we could possibly partner together to give you the smile that you've always wanted. You get one life. Make it your best. You deserve the best food. You deserve the best relationships. You deserve the best career. Our proprietary Excel dental implant process will restore your ability to enjoy the food that you love. Excel implants are not done in one day, but are instead designed to last a lifetime. When looking to restore your health, confidence, and life, start with the Excel dental implant process. After all, you only get one smile. Make it your best smile.
So for people with cold sensitivity or receding gums, I guess there's two ways to do it. You have a new technique.
Yeah, so the typical way to do it is your dentist will send you to a gum specialist, and then they'll go on the roof of your mouth, make a big cut, grab a big piece of tissue, go back to where you're receding, pull up the tissue, slap that tissue on, suture it closed. Not fun. Hurts.
But does it work? It works though.
It works, but you can only do 2 to 3 teeth at a time, max. Most of the people that have recession, sometimes they have their whole mouth. So we've created a procedure where we have the ability to not only use your stem cells, but use your own tissue in that position. So we're able to take your tissue where the receding is, right above it, bring it down.
So you're like pulling it down?
Yeah, we're pulling it all the way down. There's no incisions, there's no stitches, and there's no pain associated with it. And it's unbelievable.
So it stays down?
And it stays down there.
So why isn't everybody doing it? I mean, logically it makes sense if you're just pulling down the gum tissue that's receding.
Yeah, so very few people know how to do this. We've added the procedure that people do, we've actually enhanced it. We've added stem cells to it, and your stem cells have the ability to grow tissue, and not only that, keep the tissue where it needs to be.
So how soon does the cold sensitivity go away?
That day.
Is that right?
Yeah, because your tissue.
So they don't need to use the sensitive toothpaste or anything like that?
No, that's it. It's a truly unbelievable procedure.
So what are the options for denture wearers when they go to your practice, or the person that needs a full mouth of extractions? What are their options when it comes to implants?
Yeah, the beauty is they have so many different options. So let's start with something really small. As small as something just like two to four implants with a denture that clicks in and clicks out. It stays in pretty well. They're able to chew what they need to chew. I would say it's not the best. We'd say maybe the bronze part of it. They still have to have a little bit of maintenance where the food gets stuck under there, and they have to have the housings changed and possibly have the implants cleaned out the way they need to be. But we believe that we should have something that's better for patients, something that gets them out of the denture world. So the next option is more of a fixed type of thing. One of the things people hate about dentures, specifically upper dentures, it covers the roof of their mouth. So they don't feel temperature, they are not able to taste their food correctly. So we want to be able to give them something that recreates what their teeth are. That's a fixed option. And the fixed option is customized specifically for you. It's not taken out of a box, it's not made out of a piece of plastic, it doesn't stain, it stays the exact color that you want it to stay when it did in the beginning. So that's called the zirconia, or the fixed option.
So full arch of teeth that don't come in and out.
Don't
it
come
seems
in
like
and out.
that's what everybody wants.
Yeah, and the problem is that they weren't able to get it, or they're not able to get it because the people that do it don't know the way that we do it. So
Because you're doing it in the same day.
Yeah,
Because you have the lab right there?
Yeah, we are the lab. So we have a huge CNC machine that has the ability to cut these teeth after we design them on a computer, and the patient can even be part of that design. Sometimes we have engineers, they love seeing that stuff.
Is that right?
Yeah, they're like, oh, can you rotate that this way? I would love to have it this way. I want this shape. And we go through that for them because it's theirs. It's got to be there for a very, very, very long time, and we do that for them.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. No more dentures. And also those people that are headed for dentures with loose teeth, bleeding gums, bad breath, he says that he could end all that you could have a beautiful smile. With us, we have New Jersey's go-to implant dentist, Dr. Jonathan. Dr. Jonathan, welcome to the program.
Hey, thank you, Randy.
All right, now before we get into today's topic, like in your practice, for people that don't know your practice, who's the typical patient? And what are the different services you offer?
So my typical patient would say is a patient that's been going to the dentist and has had a lot of dentistry done, but they've come to the point where all the dentistry that they've invested in, all the time that they've invested in, just doesn't work. They have broken teeth, they have cavities, they have bleeding gums, bad breath, and they're at the point where they really don't feel great about themselves. And we want to try and help them. So they come to us because they know that we're the people that can finally help them and give them a solution where they don't have to worry about anything ever again.
Now, you have a concept where you're able to give people teeth in one day. Is that a bit of an overstatement? I mean, somebody could walk in with no teeth, and in the same day, they could walk out with teeth.
Yeah, we created these workflows and we've created these techniques where we have the ability to take a patient from a patient not only just without teeth, but a patient who doesn't feel great about themselves, a patient who doesn't even know how to smile. We have within, I would say maybe 2 hours, we have the ability to take this patient and change them completely, give them brand new, beautiful teeth, and all of a sudden it's like they go, I feel so amazing, because they don't have to worry about it anymore.
Okay, now, at the top of the show, we said no more dentures. You believe that? Like nobody should be wearing a loose-fitting denture?
Yeah, the way that I look at a denture is a denture was invented hundreds and hundreds of years ago, and people had different expectations. Today, people want to live. They want to smile. They want to feel good about themselves. They want to go out with their friends. And a denture is just something that was invented 300 years ago. We don't go around in a horse and buggy anymore. We have cars.
Okay.
Right? So all of a sudden now, I want to be able to eat amazing food. And I can't do that with dentures. The best denture in the world will only give you 25% of a bite that somebody else will have. So imagine that. And that's the best denture in the world.
So what, they're just kind of like rubbing their
food together? They're basically, they are holding back what they really want to feel. Not only the way they smile, but the way that they chew. They're just holding them together. And they don't have the ability to do what they really want. So they don't feel good about themselves.
Now, where you are in New Jersey, are there a lot of people that are like literally headed to dentures and a lot of denture wearers?
Yeah, so we have MetLife Stadium. If you would have to look at MetLife Stadium, I could probably fill it 3 times.
Is that right?
Yeah, I could fill it 3 times, and then I would tell you that there's a statistic by the year 2020, 61 million people will need to have implant dentistry. They're going to be denture wearers.
If it's so good, if dental implants are so good, right, for replacing missing teeth, why is everybody doing it? Like, what's your take?
So,
especially denture wearers.
Yeah, so think of a denture wearer. A denture wearer, they have their dentures. They don't go to the dentist. They use their glue And till maybe 7, 8, 9 years, they have a sore spot. They go to their dentist. Their dentist does a quick clear line and sends them home. Nobody ever tells them. Nobody ever says to them, hey, you know, sticking glue in your denture every day is not the only option. We can now make you better than where you started. That's one thing. The second thing is for denture wearers, they've gone to the dentist before they wore a denture. And for them, they've always been going to the dentist, getting cavities filled, getting root canals filled, getting all this dentistry that people don't want to have done. And then finally, when they got their denture, it was like a relief, or so they thought. And they've just accepted the fact that this is the way I'm going to be. And they're afraid to get into something new, but they don't realize that dental implants, we've perfected it so well that it's easier than getting a tooth pulled.
How old can you be to get this done?
Let me tell you something. There's no age limit. If you have the ability to get up, get in your car, and drive to my office, you're a candidate.
Is that right?
Yeah, because, you know, people shouldn't think, well, I'm X amount old. Think of it this way. If you say you're only going to live 5 more years, you want those 5 years to be the best 5 years of your life. Eat what you want, smile with your friends, travel where you want to go. Do everything that your teeth or your dentures are holding you back from doing. When you look at a menu, order what you love, not order what your dentures can chew.
And we were talking in the green room, and you were saying it's hard to reach these denture wearers because they've adapted, because they don't go to the dentist anymore.
Yeah.
So what do you say to the denture wearer that says, well, my denture's fine?
You don't know the other side. You don't know what you don't know. We can help you. We can make it easy for you. We can literally change the way that you act every single day. This is something that you deserve for yourself. Don't accept your status quo of my 25% of chewing ability. Don't accept the fact that you could only order 2 out of the 30 things on the menu. Don't accept the fact that sometimes you can't go out with your friends because you're afraid that your denture is going to wear out. Don't accept the fact that maybe when your grandchild is jumping with you, you're afraid that your dentures are going to fall out.
Is this what they say?
Yeah, it's unbelievable. Sometimes I have denture wearers that come in. I said, you've been wearing dentures for 30 years. What made you decide to come? My grandchild said to me, you look funny. Something is wrong. Or my teeth fell out and we were jumping. Something was going on, and they just said, for myself and for my children, I want to do this for me.
Now, another thing, and people need to know, I'm not trying to side with you, I'm just asking the questions, but I guess it is somewhat unique that how it's normally done when you get dental implants. You go to one place that does the surgery, another dentist that puts the teeth on top, and maybe somewhere else for the imaging, and then they send it out to some lab. Right, and that's how it's normally, is that right, how it's normally done?
Yeah. And you know what? That's okay if that's the way that people do it.
But you do it all right there.
We do it all right
Tell me
there.
about that.
Because, you know, there's a saying, you put 3 dentists in a room, you ask them one question, you get 4 answers. So imagine that you have 3 or 4 different dentists working on your case. All of a sudden, nobody knows the brand of the implant, nobody knows what was done, where it was placed. Patients don't like to go to different offices. It's uncomfortable for them. It's not safe. They don't like sitting in a waiting room. In our practice, there's one doctor, that's me.
Okay.
There's one person that takes care of you, the assistant, that's me, and her. There's a person that customizes your teeth, it's me. The CT scan is done there.
Now you make the teeth even there too?
Yeah, so we...
Because you said like you're even hand painting
Yeah,
the
so
teeth?
we use digital technology to literally design their teeth on a computer. We then have a machine that can actually cut it. So we have the ability within 24 hours to cut their permanent restoration, and they don't have to wait months anymore because we are able to control it all the time. And we have their file, so we have their teeth forever.
Now, because you're doing all the different parts, is it less expensive?
Yeah, we have the ability to give patients more options. We have the ability to save patients money. And we also have the ability to give them beautiful, gorgeous teeth exactly the way they want it. Because if they see it and they're like, you know what, I would love for this tooth to be a little bit rotated. Well, give me 1 minute. I'll go to the lab. I'll rotate it for you. And then you'll have the smile that you believe is perfect.
Did you say, I mean, for some people, it transforms their life?
Yeah, you know, it's something that we don't expect to happen, but we see it over and over and over again. Let me give you an example. I had this lady come in. It was the first time she was a little bit older. It was the first time she was getting married. And she came in the consult crying. She didn't know how to smile. She didn't know...
What do you mean that doesn't know how to smile?
When we asked her, please smile, she goes, I've never smiled. I haven't smiled in years. She was a denture wearer. She had teeth on the bottom that were broken. And she said, I just want to be able to smile for my wedding. So she wanted to look great for her son, and for her husband at her wedding.
All right.
And I tell you, as we follow the transformations with pictures, because we take pictures all the time, and I can tell you that from the day she started to the day we finished, her hair was better, she lost weight, she had a twinkle in her eye, just because something had changed. I can tell you, fast forward 6 months, she got a brand new job, she's happily married, she got a huge increase in pay in her salary, and it was just, we didn't plan it, but it just naturally happened.
So like the self-confidence goes up?
Oh my God.
It can't just be because of her
the
teeth.
swagger, I can tell you the swagger changed.
All right.
And it happens over and over and over. I'm gonna give you another story. I had a patient come in, young guy. He literally came in, I think maybe he was 30, 35 years old. So when he spoke to me, he was so self-conscious about things, I couldn't even hear his voice. His hair was disheveled, his clothes were all over the place. He knew that his teeth were bad. He had broken teeth, he had flared teeth, he had crooked teeth, and he's a young guy. He wants to date, he wants to be with girls, he wants to do what he needs to do. But he knew himself, it affected the way he spoke. He spoke with the lowest voice possible. We had to ask him to speak louder. I felt almost that I couldn't hear. And I can tell you, the day we put in his new teeth, 2 weeks later he came back for his post-op, he had a brand new haircut. His hair was cut to the side. His friend who referred him said to me, he has 3 girlfriends now. The guy is now going into nursing school, he's almost finished, he feels great about himself, and it was truly unbelievable for me to be able to be part of that, to change his life.
So was this a guy, like, for example, his teeth were so bad they had to come out? He would have
Yes.
definitely worn dentures.
Definitely, and imagine for a 30-year-old to have to wear dentures, it's debilitating. It's really, really sad. To be able to have to take your teeth out at night, it's embarrassing, no matter what age you are. Imagine at night you go out on a date with somebody, you know, people are on the internet, they're on Match.com, and you can have the gorgeous picture, you can have a gorgeous smile, or you can smile with your lips closed, but there's one hidden smile, one hidden secret that you have, that nobody will ever know. You may have to take your teeth out at night. But imagine that night you can go out to dinner with your date, eat whatever you want, order whatever you want, and then at night, you don't have to take your teeth out and put them in a cup. How amazing is that gonna make you feel? It's gonna change you. It's finally, denture wearers worry about their teeth. It's something that's part of their lives. They're always worrying. Me and you, or people that have implants, or people that have teeth, they don't worry about it. They worry about other things in life.
You don't even think about it.
You don't think about it. But imagine when you take that burden off of them to say, you don't need to worry about it. We're going to give you teeth that possibly will last a lifetime for yourself. You take care of them, they'll be there, be able to smile, be able to eat whatever you want. You'll be able to feel the way you were when you were 18 years old and you had healthy teeth.
Now, how soon can they eat? Okay, so on the day of the procedure, you give them their fixed teeth that don't come in and out, full arch of teeth. How soon can they eat?
So we tell them that the day that they get their teeth, on their first day in terms of their implant surgery, they have to, it's purely smile. It's to rebuild their confidence. They're going out, they're smiling, they're feeling great about themselves. They're not to eat. Okay, but because of our procedure that we do, our proprietary procedure that we created, we can get a patient in their permanent teeth as fast as 6 weeks.
Okay.
In 6 weeks, they'll be able to chew and eat whatever they want. Nobody does it like us. We use stem cells, we use specific techniques that we do to be able to increase healing. We use digital technology to be able to design these things much quicker, to be able to give them things that fit perfectly. We used cameras instead of goop. You know, people hate that goop in their mouth.
So a camera measures inside their mouth?
Yeah, so we use a
right?
camera to measure the inside of their mouth. We use a camera to scan their face so that we know the way their smile should be. So I just want to back up to clarify what I said about the 6 weeks. The day of their surgery, they will never walk out without teeth. They'll have beautiful, gorgeous teeth. And that will be their blueprint to be able to see what they want, to make sure that it looks exactly what they want. They
Like they're trying it in for a
They're
while.
test driving it,
Okay.
right? And they can do whatever they want. We can change the color, we can change the length, we can change anything for them. So for 6 weeks, they try out, they smile, they go to speak to their friends, they go to their family to say, do you like my beautiful new smile, right? If they feel like
Do they ever say, I want these, I don't want the other ones?
Most of the time, they love the ones I put in.
Okay.
They never change their minds. And then 6 weeks later, we will go ahead and we're going to make them their brand new restoration that's permanent, that's fixed. We usually tell them the day they come in, make a reservation for a restaurant because you're going to go and have that steak you've been dying to
So they
have.
can eat that night after
That
the
night.
procedure? Like they have to be careful?
If they come in the morning, they could have lunch.
I mean, do they have to be careful?
No, they can eat whatever they want.
Could you bite like let's say a raw carrot with your front teeth?
Yeah, you typically can because of the material that we use today. Some offices, they may go ahead and make you a screwed-in denture that's made out of plastic, that's picked out of a box where every tooth is exactly the same. In our practice, we make them out of zirconia. Think of it as a white metal. That's how strong it is. They have the ability to literally take a hammer. I'll give you a story. I wanted to tell you a story. I had a patient, okay? It was really sad. She was such a wonderful person. We did full implants on her. Okay, full upper implants, full lower implants. And it was sad. I live in New Jersey. It always snows. And she fell down her front steps. She cracked her hip. She didn't touch her teeth. She fell on her face. She broke her nose. Her teeth did not move. Nothing happened to them. These things are stronger than your bones.
And maintenance? Okay, you take somebody with broken down teeth. Sometimes they have to be extracted. You give them teeth the same day as well?
Yeah, so we love to be able to do that because one of our philosophies is that we want to be able to recreate nature. We don't want to give a patient a denture again. We want to give them the most natural way. So our proprietary procedure is that we recreate what they had that was beautiful when they were younger. Right? And then we have the ability to screw these things in or cement these things in so that they look beautiful and they can do whatever they really need to do.
So I know one, a dentist actually was on my show that went to one of your courses. Is that why they go to learn this, fixed set of teeth that don't come out? Instead of the snap in, snap out?
Yeah, they want to learn a way to be able to give to their patient something that's predictable, that costs less for them, and at the same time they could pass the savings on to the patients. Because here's what happens, typically around the world, is that only the rich get permanent teeth. Only the high end get the permanent teeth. But we're the dentist to the people. We have the ability to give people what they want.
So you could do high end teeth
at a cost that's affordable for patients. We have so many options for them based on what they need and what they want. And that's why we believe that fixed teeth are the way to go. Because when you have fixed teeth, you have less complications, you have less things that you need to do. Let me give you a story. I had a patient come in. She came in, I saw her 8 years ago. I gave her an upper denture. Okay, she had an upper denture, she was happy with her upper denture, she comes back to me 8 years later, her lower teeth are now gone. We know that a lower denture is not the same as an upper denture, it's actually very, very bad. She's super young, she's like 37 years old.
Oh my goodness.
Right, and she doesn't have a lot of money. So we needed to create something specifically for her. So we needed to be able to do something for that. She'll be able to afford it. She's 35 years old and she doesn't have to take her teeth out, her lower teeth out, and not be able to eat ever again. So we created this flow where we were able to place her implants. She never left, the same day she left with permanent teeth so that it wouldn't be a big deal for her. 6 weeks later, we took out her temporary teeth and we gave her permanent zirconia teeth in one piece that are basically unbreakable.
And these look like veneers? I mean, they look like, or just real teeth?
So we don't want them to look like veneers because veneers look fake. We want people to say to you, wow, you have a gorgeous smile.
Okay.
Not, wow, you have gorgeous veneers. We want people to say, something changed, I'm not sure, but you look great. You look rested. You're smiling better. Because, smiling is the new currency. So one of the things that we love to do is after we insert the final teeth, our patients don't see it yet. So we love to see their reactions. And we've done these cases over and over and over again. And every reaction is exactly the same. Some people cry, some people smile, some people give thumbs up, but every single one of them go like this. Because they had such a load on them. They were worrying so much about it. It's been taking over their lives for years. Some people, they think about getting this done, but I've had patients say to me, I drove by your office for the past 2 years. I've picked up the phone and hung up because I was scared.
Wow.
But finally, they're like, I wish I had the courage to do this so long ago because I'm so happy. Because it's really life-changing. That's what we do. We change lives.
Yeah, but what about those people that have really bad gums, like gum disease, where it's bleeding, loose teeth? Are their gums too bad to do this?
Yeah,
the implants will stay in there?
Yeah, it's funny you say that, Randy. That's my typical patient. I have a patient who's been going to the dentist or has been afraid to go to the dentist. Their teeth are loose, their teeth are broken, they've had dentistry that breaks down, and they're at their wit's end. They need a solution. The last thing you want to say to them is, hey, I'm going to pull all your teeth, here's a denture, get out of here. It's debilitating to them. We don't want to be part of that. We want to be able to give patients better than where they're started. Today, in dentistry, we're the only profession where we have the ability to do a procedure on a patient and not only get them to where they were, but better than where they started. And that's amazing that we have the ability to do that. Most doctors just get you okay. They let you get you by. They give you a medication, you do what you need to do. But with dental implants, I can make you better than when you started. When you come in, you're going to be better than where you were. And that's unbelievable.
So if somebody's watching this and they've got a mouthful of teeth that are just, I guess, failing or just, falling out, I guess. How soon, if everything works out right, how soon, what's the turnaround time to get this full arch of teeth, upper and lower, that don't come in and out? Supported by dental implants.
Yeah, so come in for a consult. We discuss what your needs and what your wants are. Schedule your surgery. That day you walk out with a brand new smile. People cannot believe it.
Are they skeptical?
They're so skeptical. But when they're sitting in the chair and we give them that mirror, they look at me and they say, "You were right." And it gives them the biggest smile because they literally it's like a total flip, like Jekyll and Hyde. But they become an unbelievable person. They get this swagger. All of a sudden they care about everything around them, what their hair looks like, what their clothes look like, what their smile looks like. All of a sudden they become the best dental patients. And because they can actually say they love coming to the dentist.
What about pain? I mean, it seems really painful to do this. Like, what do the patients say, I should say?
So I can tell you that during the procedure, there's no pain at all. For the patients that
are they sedated?
So there's the option. We have a board-certified anesthesiologist that can be brought in. We bring them in, totally safe. We put the patient to sleep. They go to sleep. They wake up. They have a brand new smile. Patients that don't want to go to sleep, that's totally fine. We encourage that. We get them numb, and they don't feel anything during the procedure. Implants do not hurt. It just doesn't hurt. Teeth hurt, but implants don't hurt. So it's actually very, very easy, especially if you're a denture wearer. It's a piece of cake. We use computer-guided surgery, where we'll do your surgery before you're even there on the computer. You could come in, we could finish your surgery in under 2 hours.
So it might be, so we don't have to put disclaimers, because we're airing this on TV all over the country, that there might be discomfort, right? A little bit of soreness in the gums. Is
Absolutely.
The gums what are sore the most?
Yeah, I mean, they're going to be a little bit sore, but I would say maybe 3 days. After 3 days, they'll feel great.
And what are they taking at home? You give them some pain
Advil,
meds? Just Advil?
Yeah. Some of them even actually, I call them that night to see where they are for a post-op. Like, let's say I do the surgery at 9 o'clock. I call them at 3 o'clock. They're like, "Oh, I'm at the mall."
So they're fine?
They're totally fine. Everybody's reacts differently, but overall, I would say most of the people are fine. They do really well.
Now, people with really bad teeth, right? Which that's why they go to you. Like you say, you're the last resort. They don't know their options. You say they can be discriminated against, judged.
Yeah, so when somebody looks at them, it's funny that you said judged. I had a judge who was my patient, right? It has nothing to do with the amount of money that you have. It has to do with, most of the time, it's fear and trust.
Because with people with bad teeth, you think maybe they don't have money. But like you say, that's not the truth.
That's not the truth. It's really they can't find the right person to help them. They've searched, and they've come to the point where they've just given up, and then it just spirals out of control to where they're looking for, they restart their search to find somebody. So yeah, are they discriminated about? Absolutely, because all of a sudden you look at their teeth and you think, this person lives in the street, this person doesn't care about his teeth. But let me tell you something, most of the people that have bad teeth, they've cared about their teeth. They've gone to the dentist. But
so
dentistry's let them down.
Everything we're talking about is teeth that are fixed in there.
If I have the ability to give my patients a Ferrari at the cost of a Toyota, why would I give them something that's not better? If I know that I can do it for them, they can afford it, and it's going to change their lives, and it's going to make them supremely better than where they are when they started, why not? A snap-in, snap-out denture is great, and it's okay. It's a great option for people. But for me, I would never want to have to take my teeth out to clean them. I would never have to worry about them popping out. I want to be free of maintenance. The people that have permanent teeth, they still come, they have their teeth cleaned. But
so they're back in the system.
They're back in the system because then the snap in, snap out, it's made out of plastic. It can still break, and then they have to start again, right? It's possible that they get food stuck under there and the implants may get infected. It's a problem. But the permanent teeth stabilizes everything. It allows you to be able to just take care of yourself better. It gets you out of the denture mindset. You don't wear a denture. Just because you wear a denture and it has implants doesn't mean you have teeth. When you have permanent teeth, you don't think of it as implants. You think of it as, I have teeth. I'm back to where I want to be.
Could they eat like popcorn or nuts or chewy things like a pizza?
Yeah, I love pizza.
So it doesn't matter.
Pizza's great.
So they can eat whatever they want?
Yeah, they can eat whatever they want. They just have to eat normally.
So you don't want them
They're just so
on
excited
ice.
they chew so quickly. They have to just chew normally and everything works out. I told you, it's like a white metal. Imagine I give you metal as teeth.
So they look like porcelains. I mean,
They look. You cannot tell that they're not real.
So it's kind of like a smile makeover too.
Absolutely, we treat everything like a smile makeover.
So like women will have a little bit different look than the men.
Yeah, so we really customize it. One of the things we love to do is we tell them, bring us a picture when you were 20. They bring us their wedding photo. We look at it and we duplicate it because that's what
You can do that?
Absolutely. We have digital technology. We can take a picture and import it, and we lay the teeth right over. We can change anything today. So yeah, so we had a patient. She used to be an actress. Right? She brought us a picture of the way she used to look like. Gorgeous, gorgeous lady. She was about 75, 77 years old. And she said, I want to look the way that I looked when I was 25 years old. So I said, no problem. You were a model, you were an actress, bring me the picture. And we had the ability to take that picture. We created digital technology, we brought it in, and we gave her the smile that she had when she was 25. She's like, oh my God. And she's an actress, she loves to talk, and it gave her life again. It was amazing. She comes to my office, I can't work on her, she just talks all the time because she's just so happy. She's like, it changed her life.
Now, just as a recap again, because we're out of time, probably a minute left, but somebody that they have teeth that are just loose, they're falling out. From extractions to fixed teeth, how soon? What's the turnaround time on that?
Yeah, so they would come in the same day of their surgery, we would pull their teeth. We wouldn't even have to make any incisions. Through the same holes where their teeth were, we go ahead and we place the implants really, really quickly, and that day they walk out with brand new permanent teeth.
Is that right?
8 to 12 weeks later, depending on where they are, 6 to 12 actually, depending on the bottom or the top, they go ahead and we now duplicate their temporary that they loved, and we make them permanent teeth, zirconia, that they look gorgeous. Those are the cases that the patients look unbelievable because their architecture is there. We just have to take from disease to healthy. It's like a third set of teeth.
Now, when you're on a consult and they give you a hard luck story, because these people had really bad teeth, bad experiences, do you ever get excited where you're going, this is going to be good?
Oh my God. When I see one of the things we do is we take a before picture and we put it up on the screen. And when I see it, I get so excited because I can now actually see the future. I know exactly what I'm going to do and what it's going to look like because I've done it so many times. And that's the thing. People need to we try to show that to people to say, we've done so many cases just like yours. Here's the pictures. And it just lights them up. It gives them a sense of hope. They're inspired to say like, wow, I've come to the right place. People are here to help me, finally. I've been looking for this.
Now what about the guys? Because you were saying guys put it off, and like women are more proactive at this, but men put it off. They just want to be out of pain. And you said that the guys, all they want to be is out of pain. They don't care how it looks, but they end up liking how it looks.
Yeah,
more
they
than
love
they're
it.
eating.
Yeah, so what happens is that they were so full when they had dentures or when they had broken teeth. They knew that it never looked good, so they were focused on getting them to be able to eat correctly. Once we give them the eat function, all of a sudden they're like, well, I don't have to worry about eating. Let me worry about what they look like now, and they become like they're one of our best patients because they love to talk. And I practice in New Jersey. They just feel great about themselves, and women also. Women have the ability to all of a sudden say, wow, I can now go on a date. Wow, I can now smile. Now,
are they doing selfies on Facebook now?
They're doing all that stuff.
Irritating all their
I tell you
friends?
what the biggest thing is for denture wearers is sometimes their husband doesn't even know that they wear dentures. Yeah, and they've set up the consult when their husband is on vacation. And they say, how fast can I get this done before my husband comes back?
And that's happened before?
Oh my God, it happens all the time. It's unbelievable.
Well, the husband must come back and say, what the heck is going on here?
Well, if she likes the way her dentures look, we just make them impermanent. So he'll never know, but she doesn't have to take him out at night when he's sleeping.
So it's that easy. We are out of time. Okay, so we should mention, you teach this to other dentists. You teach at the university, implant dentistry. Also, you have the technology where you do it all right there. I mean, it's like a lab, your own lab. You make the teeth right there.
I have like a CNC machine that cuts everything.
And then you pass the savings on
to the patient,
to the person. Insurance. We should mention this because we get emails about this. Medical insurance, even the best, doesn't cover the whole process. Medicare, Medicaid
Financing
definitely doesn't cover it.
Listen, yes, it doesn't cover it, but you know what we have? We have financing. We have the ability to make it financially available for patients with monthly payments. We have no interest. We have long-term payments to help people out. If they have good enough credit, pretty good credit, they'll get approved.
How often do you finance these type of procedures?
I could say 90 to 99% of the time, we are always financing it. Because we want to help
Even people with money are financing?
Yeah, absolutely. Why not?
Yeah. Okay.
Help them out to make it easy for them and make it less of a burden. All they have to worry about is when is my appointment and when am I going to get my gorgeous smile? That's all they worry about. We take care of everything else for them.
Okay, good. I want to thank you for coming on the show.
Thank
if
you.
they want to learn more, they go to your website. And they get to see you on the consult?
Yeah, absolutely. Only me. I'm the doctor.
All right. I want to thank you. And you go by Dr. Jonathan.
Dr. Jonathan.
All right. I want to thanks for coming on the show.
Thank you so much, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
If you're only missing one tooth, why a dental implant over a traditional bridge?
Yeah, so one of the things we say in our practice is a bridge is made to be driven over, not placed in people's mouths. Okay. So think of a bridge. Your dentist now has to cut down a tooth that's perfectly healthy. And every time you touch a tooth, you're now creating the downward slope of something's going to happen. Depending on how old you are, it's probably one day that tooth is going to need a root canal, it's going to be taken out. So now you've created two other problems. So a dental implant, we just place it right in the middle, and then you get the tooth back that you have. Your tooth on the side is healthy, the tooth on the other side is healthy, you're able to floss, and you don't have to worry about anything.
What about cost?
So yeah, in the beginning, it's actually a little bit more expensive, but long term, it's actually much cheaper.
And it lasts for how long?
As long as you take care of it.
Okay. So it can last as long as you last?
That's right.
What about pain?
Yeah, so single implant, we can do them computer guided, we can do them in under 5 minutes. No pain.
So pain is not an issue?
No, implants don't hurt, teeth hurt.
So you do a lot of smile makeovers using porcelain veneers. So take me through that process in your practice.
Yeah, so for us, it's all about smiling, designing their smile. So we really have a conversation with them to see where exactly they want to be. The last thing we want to do is give them horse teeth. The last thing we want to do is give them teeth that are white, that look fake. What we try and do is recreate their nature and enhance it so that people say to them, you have a gorgeous smile. This is what people want to say. We never want to say to people, hey, where'd you get those veneers done?
All right.
You want people to say like, I have a smile by Jonathan. That's what I had done.
Okay. Now with when I see, because I think I told you this already. I feel like I could spot veneers walking down the street because they seem a little bit big. So when you see these big veneers, is that what the patient wanted, or do you think it's the lack of artistic ability on the dentist's part, or a combination of both?
Yeah, so I doubt that people want to have big teeth because they want to have teeth that look real. That's what they're trying to do. They're trying to look better about themselves. Right. I think sometimes it's either lack of artistic ability. It's like when you look at somebody and you say, wow, this guy's an artist. Wow, they look beautiful. And that's what we pride ourselves on the ability to create harmony with the patient's smile. We look at everything. We look at their eyes, we look at their nose, we look at their lips, we look at their chin, everything to make it fit within that frame. Because that's their frame. Their whole mouth is their frame, right? Their whole face is their frame. We need to put those teeth to make it fit, not to make it stand out.
Now you think the smile is pretty important.
Oh my God, the smile is the most important thing. It's the first impression. When somebody sees you, you can either or you can smile. It breaks the ice.
Yeah.
When you see somebody who just smile, and let me tell you something, if you don't have the smile that you want to have, it's going to hold you back. So you deserve it for yourself. To do this, have the smile you've always wanted. Smile the way that you feel. That's the way it needs to be.
So what should somebody look for in an implant dentist? Somebody that's going to give them a fixed set of teeth.
Yeah, so the first thing they need to look for is when they make that first phone call. How does that person answer the phone? Are they warm? Are they welcoming? Do you know that this is going to be the place that's safe for you, that's going to take care of you? Well, let's say you find that person, they answer the phone, they're great, they're really nice to you, they get you in right away. Now when you meet the dentist and you meet his team, how long has he been doing this for? How many has he done? Does he have cases that look exactly like yours? Is he board certified? Does he have the ability to make the teeth himself or within the facility that he's in?
So look for somebody also with the same lab or somebody that knows how to do the fixed teeth.
Right, absolutely. They should also find somebody that's going to give them options. That doesn't just say, this is what we do, we only do one thing, we all have a hammer and everything looks like a nail. Because every person is individual. Find someone who's going to listen to your needs, find someone who's going to find something that works for your life and for your expectation, not for theirs, but more for you. But you know what? I'd be happy to see them.
And then look at their work.
Absolutely.
Because you've got lots of photos.
Yes.
When they're there.
Yeah.
So you can show them, give them an idea on the consult what it's going to look like.
Yeah, absolutely. Most of the time we see the patient and we say, well, I know that Sarah was exactly like you. Let me show you Sarah's case. And we show Sarah's case and they're like, whoa, is that me? No, that's not you, that's Sarah. But this is what Sarah looks like when we're done with her.
Okay.
So it's wonderful.
Now, you must have you teach the topic, you lecture on the topic, you write about the topic, and you do a lot of it.
Yes, this is what we do. You want somebody...
Is that fair to ask your dentist?
Absolutely.
It seems embarrassing to ask your dentist, what's your experience?
Well, let me tell you something. This is for you. This is your health. You want the best person to be able to do it for you. You don't want somebody who dabbles in it, who does a filling here and a couple implants here. You want somebody who's focused on this, someone who does this every single day, and who looks at your case and says, well, I've done 20 of those or hundreds of those exactly like yours, and it's a piece of cake for them. You don't want someone who comes in, they're sweating, they're shiny, right? You want someone who comes in and says, yeah, this piece of cake, we're going to do it. This is exactly how long it's going to take. This is what's going to happen. This is the positive, this is the negative, and we're going to go forward.
And I like how your patients call you your first name, Dr. Jonathan.
Yeah, because they're part of my family.